Hey classmates, I'm going to talk about SVN today. Um, this is an SVN or small volume nebulizer. It's an aerosol generator used to deliver liquid medication like albuterol to the mid to lower airways. High velocity pressurized airflow is used to convert drug solutions into fine mist with particles that can be inhaled using a face mask, which I have here, or a mouthpiece. It can be used in acute care, pre-hospital, or emergency rooms. Indication for SVN is that it's used to treat respiratory related symptoms like mild to moderate asthma and COPD exacerbation. It can also be used to break down thick secretions with hypertonic saline. For adults and children that can follow commands, a mouthpiece can be used. If there's a patient limitation, it's best to use a mask. So contraindication for SVN is hypersensitivity or allergic reaction to the medication being nebulized. You can also aerosolize infection or bacteria that are airborne, so we need to use this in an enclosed room. It can also increase heart rate, increase blood pressure, nervousness, or palpitation, specifically for albuterol treatment. Stop treatment if heart rate increases to 20 beats per minute and inform the doctor.
So for the setup, we have the tubing, the neb cup that needs to be filled between 3 to 5 mLs of liquid solution to optimize the drug delivery. We have the mouthpiece, we have the T tubing, and then the extra extended tubing, and 6 to 10 liters per minute via medical air. We also have the mask, SVN. The kit comes with a mask, also a cup, same solution, ml, 3 to 5, and then extra tubing.
Hey, sir. My name is Chris. I'm one of the RT students here. How are you?
I'm good today, thank you.
You're good
Having
today?
a shortness of breath.
Shortness of breath. How long has that been going on?
It's been a while for a while.
For a while. Did you use your inhaler today with the asthma? You're asthmatic, right?
Yes, I am asthmatic.
Did you use an inhaler?
Yes.
Yeah.
But it
Didn't work. Okay. So the doctor gives an order for a breathing treatment. Okay. So I'm gonna set this up. I'll be right back. Before I get the setup, I'm gonna listen to your lungs here. Okay. Deep breath. Another one. Deep breath. One more. All right. Kind of tight. Not a lot of air movement. So I'll get the albuterol treatment. Okay. I'll be right back.
Thank you.
Set it up to 6, between 6 and 10. 6. All right, so here's your albuterol treatment. So what I want you to do is just take normal breaths, and then in between take deep breaths, okay? And then I'll be back, and it'll be done between 5 to 20 minutes. So, all right, I'll be right back. All right, looks like it's pretty much done here. So let's turn it off. How do you feel?
A lot better.
A lot better. You feel like you're moving a little bit of air.
Mm-hmm.
Yeah, you sound better. All right,
Thank you.
take care. All right. Yeah, you're a little bit of wheezing, but that's normal. I hear a lot of air movement. So, all right. I'll let the doctor know and see how it goes, okay? All right.
Hello, my name is Joy, and today we're going to talk about the metered dose inhaler, or MDI. The MDI is a pressurized sprayer that delivers a measured amount of medication. The MDI is used to administer bronchodilators, anticholinergics, and steroids. It is usually used to treat lung diseases like asthma and chronic obstructive pulmonary disease, or COPD. Your metered dose inhaler contains a powerful medication, and the medicine must be breathed deeply into your lungs in order for it to work. It will not work at all if it only reaches your mouth and throat, so it is important for the patient to be taught of the proper technique when using the inhaler. The use of MDI is contraindicated in patients whose airflow obstruction is due to an inhaled foreign body, or if the patient is unable to help coordinate inhalation. Your healthcare provider may prescribe a special chamber or spacer to use with your inhaler. A spacer increases the amount of medicine that goes to your lungs and may make your medicine work better. Spacer is easier to use because without the spacer, you have to simultaneously press the inhaler down and inhale at the same time, which takes a lot of practice. This can be a concern for really young patients or older patients who has issues with holding an inhaler. Now, I'm going to show to you how to use the inhaler with a valve holding chamber or a spacer. First, check the expiration date and dose counter on the inhaler, and do not use if it says 0. 0 means the inhaler is empty and needs to be replaced. Prime the inhaler by shaking it for 10 seconds and spraying 2 or 4 puffs into the air based on your medicine instructions. Prime again if you have not used the inhaler for 1 to 2 weeks or have dropped it. Priming does not waste doses. Now that the inhaler is primed, you're ready to connect the inhaler to the spacer. Make sure that the cap of the inhaler is off, and then connect the inhaler to the spacer. Have the patient sit or stand up straight, and then hold the inhaler with your pointing finger on top of the inhaler and thumb on the bottom. Shake the inhaler to mix the medicine for 8 to 10 seconds and remove the cap from the mouthpiece. And then breathe in and breathe out all the way through your mouth away from the device. Put the inhaler mouthpiece into your mouth above your tongue. Close your lips tightly around the mouthpiece. Press the inhaler down once to release the medicine and begin to breathe in through your mouth. Keep lips closed around the mouthpiece and breathe in for 3 to 5 seconds using one deep and steady breath to pull the medicine into your lungs. If the holding chamber whistles, it means you're breathing in too fast. Remove the chamber from your mouth and hold your breath for up to 10 seconds. Breathe out slowly through your mouth and then repeat these steps in 1 minute if using more than 1 puff. Then put 2 fingers between the mouth and the inhaler and then breathe in and out all the way through, and then hold the inhaler with a pointing finger on top of the inhaler, then simultaneously press the inhaler down, then breathe in slowly to take in the medicine, and then hold the breath for 10 seconds, then breathe out slowly. Now I'm going to demonstrate to you how that's done. Hello, my name is Joy, and I'm your respiratory therapist. And today I'm going to show you how to use the MDI with a chamber. Okay, so this is your MDI and this is the chamber. And first you want to do is check the expiration date on the MDI, since this is new, just to make sure that it's not expired. And then also check the counter, make sure that it's not 0, because 0 means it has to be replaced. Okay, and then once you start, since this is new, you have to prime it, and then so each and every time, like you haven't used it for like a few weeks or you dropped it, you have to prime the inhaler. So, and then since this is new, you have to prime it as well. So what you do is you shake it first, and then you open the cap, and then you prime it. Depending on the medication, it should be like about 2 to 4 puffs, okay? And then you prime it away from you, okay? And then after priming, so what you now do is it's ready for you to use, and you need to connect it to a spacer. Okay, so what you do is you just open this one and then connect it to the spacer, and then you want to make sure to open the mouthpiece as well. Okay, and then so when you're ready to take it, so what you do is you shake the inhaler, and then after that breathe in, and then breathe out all the way, and then when you're ready to take it, put it in your mouth, in the mouthpiece in your mouth, and then hold it like this, and then when you're ready to use it, you breathe all the way in and all the way out, and then put the mouthpiece into your mouth, and then press it, and then breathe all the way in slowly, because if you do it fast, it's gonna make a sound. Okay, slowly, and then hold it for 10 seconds to make sure that the medication goes into your lungs, and then breathe out slowly. Okay, so after you're done, you just close the cap, and then you close the cap of the medication. Okay, and then you store it in a cool, dry place. Okay, do you have any questions?
No, I think that's it. Yeah.
Okay.
Hello, my name is Hoang. I am your attending RT, and today I'll be introducing you to DPIs, also known as dry powder inhaler, and they usually use corticosteroids. And the indications for DPIs are COPD patients and asthma patients, and also cystic fibrosis patients. And the contraindication would be patients who are younger or older, or are currently having bronchospasm. In that case, you'll use a rescue inhaler. This is more of a maintenance drug, and it's also necessary that you have to be able to have enough inspiratory flow, basically enough inhalation to be able to inhale it yourself, since it is powder form or not. Hi, I'm Hoang. I'm your attending RT. What is your name?
Joy.
Joy? Okay, good. That's you. Today I'm teaching you how to use a DPI, which is a corticosteroid. It's a maintenance drug. It's not for rescue inhaling. So if you have active bronchospasm, do not use this. And another thing I'm going to teach you is to open it, you just flip it, and then what you do is press the button down to crush it. And once you crush it, hold it like a sandwich, because if you put it upside down, all the powder will fall out.
Okay.
So what you're going to do is you're going to exhale all the air out of your lungs, and then when you're ready, have a tight seal and inhale sharply, because you're going to need enough flow to bring that powder into your lungs.
Okay.
And once you get into your lungs, you're going to hold it for 10 seconds and allow your lungs to absorb it, and then breathe out. And when you're done with that, make sure you get your water and rinse your mouth out, because you're going to have a lot of thrush in the back. Basically it's fungus, and you don't want to breathe that in the back of your throat, which is a no-go for nobody. And make sure you spit it out. And also to store this, make sure you're put in a dry place, because it will clump up. And also don't blow into it. And yeah.
Okay, thank you.